Welcome once again to Church Alive, and this is your host and president of Church Alive Development Corporation and the proud pastor of Church Alive Community Church. And once again, we're here to bring you a holistic approach to the gospel. And we are proud to present Ask Dr. Tommy O. And you've seen this program from month to month, and it has made a major difference in your lifestyle, and it has made a major difference in improving the health awareness of all our viewers. And we thank you for allowing us to come into your homes. So without any further ado, I'm going to go right to Ask Dr. Tommy O. Dr. Tommy O, I can't welcome you to Church Alive, but because this is Ask Dr. Tommy O's show. And it is a real wonderful feeling that I have, and I've always had in our relationship, as you have been servicing the community. And I know all the clergy of the Bronx and of the city of New York are thankful for the medical advice that you've been bringing us over the last months. Dr. Tommy O, welcome.
Thank you. Welcome.
Okay.
Thank you. I appreciate being part of Church Alive in our community.
Okay. Now, before we go to Ask Dr. Tommy O, and deal with eating disorder, anorexia, and bulimia. And that's what we're going to be talking about in this segment. We had a live broadcast about a month ago, and a gentleman called in, and the show was on prostate cancer. And he asked a question, and we were ready, but we felt it wasn't clear to give it at that time. So I'm going to ask you to go back to that live show, because that gentleman might be watching. And I want to respond to that question that he had as we dealt with prostate cancer. Okay. Go right ahead.
Okay. Basically, I want to demonstrate, we would like to demonstrate what we call continuity of care and continuity between show. It's very important for us as for an outreach and awareness. Our live show was on prostate cancer. Again, I'm going to define prostate cancer as an overgrowth of the uncontrolled overgrowth of the prostate gland. Our live show, we had an individual gentleman that called in. This gentleman was 43 years of age. He said he was diagnosed with prostate cancer. He also had a radical prostatectomy. He posed a question. The question was, what is the return rate of developing prostate cancer after he has surgery? What I'd like to go into is it's all based on the extent of the cancer itself. And what does that mean? I'll break it down to is this. Once the amount of tissue that is involved, we have what's called localized and distant metastasis. If it states in all the literature that if the cancer is very localized and they perform the radical prostatectomy, theoretically there should be almost a 0% recurrence rate. The literature states that there could be a 10 to 15% recurrence rate if there is extension into the surrounding tissues. So basically that is the answer. Theoretically 0%, again, there's no perfect world. There is a recurrence rate. However, there's an increased recurrence rate with extension into the local tissues.
Okay, Dr. Tommy O, I know that person and many others who were watching our program have now gotten a more positive answer, and I know we've helped someone. But we're going to go into eating disorders and anorexia and bulimia. Now, but I think we need to first define what is eating disorder.
Okay. This is very important, especially with our society today, with the pressure of looking good and so-called being vain. There's a lot of peer pressure from the model industry as well as the designers, the fashion industry as well with the magazines. I will define eating disorder as anorexia and bulimia. There are other types of eating disorders. Eating disorder such as anorexia and bulimia are considered to be characterized as a loss of body weight that is 15% lower than ideal body weight. And I just want to define ideal body weight before we move further.
That's good. That's important.
The ideal body weight is calculated on the height and musculature, meaning the size of the skeleton of the person. Like a height and weight, that's how it's calculated. And what I mean by is how tall you are versus your frame size, small, medium, and large. And we have a calculation, and we're able to calculate based on your height, based on your frame size, and that will give us an ideal body weight. And then based on that, 15% less than ideal body weight.
Okay.
That is the definition of an eating, or characteristic of an eating disorder.
Now, eating disorders have an association. In other words, a lot of people maybe a physical situation. You want to describe what the association is to the physical anatomy.
Right. Well, we have 3 different areas which we'll cover right now. The first area would be the actual physical changes in the body. Physical changes in the body is where we have changes in the muscle tissue, the muscles themselves, where we have the so-called muscle wasting. We also have changes in the fat of the body, where we have fat displacement, where the area of the fat tissue, it's being removed, broken down. We also have the psychological component, where you can have depression that's associated, as well as possible suicidal tendencies. Also, along with the psychological aspect, we covered the mental aspect. We have the physical aspect as well.
What about metabolic?
The metabolic aspect would be a deterioration of the organ systems themselves, the actual functioning, where we have breakdown of the elements, which we call the nutritional component, where we're not taking in enough nutrition to support the organ system. Then we have organ system failure. Very serious and detrimental and life-threatening.
Okay. Now, there are some statistics that I think we need to understand that allow us to see that this is really a problem. And would you deal with those statistics?
Right. As I like to, with each show, I like to demonstrate the amount of statistics. It's very important to see how significant pathology is in our community. In this particular situation with anorexia and bulimia, this is pretty significant. It's estimated that 9 out of 10 women suffer from some sort of eating disorder. For men, and yes, anorexia and bulimia is associated with men, it's estimated about 1 in 100 men suffer from some sort of eating disorder.
That's really some high statistics.
It is.
And something that's very troubling and needs to be addressed.
Strong in mind, knowing that through